Welcome back everyone, I'm Troy Thompson. I'm over here with Dr. Eric Smith from Georgetown Bariatrics and Advanced Surgical Services. Welcome back to the show, my friend.
Thanks for having me.
Nice to see you. Okay, well, Georgetown Community Hospital has become very well known, not just in the state of Kentucky, but also nationally because of bariatric surgery. How has that all come about?
You know, it's been over years. Even before I came here, Georgetown had a large focus on bariatric surgery. They put a huge emphasis on that because it's a thing that changes people's lives, and so they've invested in it. When I came here, they continued to help invest in me to grow what we have now, which has been pretty amazing.
And we're talking about not just grow, but expand exponentially, because we've opened up this huge new clinic where we're talking right now. I want to talk a little bit about revisions if I can, because it's something that people like to understand. It's not just about getting the surgery and then saying see you later.
Right.
When we talk about revisions, is that for people who have had surgery and it's coming in for checkups, or how does that all work and what's the process of that?
Well, revisionary surgery is for someone who's had a previous bariatric surgery, and it may be one of the many types that are offered.
Right.
And they've either developed a problem from that, or maybe that surgery is not really the best surgery for them and the results that they want. And so as bariatric surgery has grown throughout the United States, there are a lot of people that are offering surgeries, but they may be only offering one type, which isn't always the best one for a patient, or they may not feel comfortable with the experience of doing complex surgery and revising those. And so we're starting to see even more people because we've done revisions for a long period of time.
Well, let's stay on the topic of revisions, if you wouldn't mind. How does a patient know from home, sitting at home right now, who may have already had bariatric surgery, and that they may need a revision? Is there signs, or is it just see your practitioner?
You know, oftentimes if a patient's had surgery and they've gained some of their weight back, that doesn't necessarily mean they need a revision, but they need help either with just dietary education, and we can make sure that surgery isn't needed as well. Maybe someone had something like a sleeve gastrectomy and they're battling with reflux, which is one of the side effects of sleeves in certain patients. They may need a revision. And so those would be somebody who could reach out to us and we could help them. Well, any questions we'll answer for them.
And that's what I was about to ask. Why is it so important as part of your practice now, the revision part of it?
Because it's comprehensive. You know, I think in order to have a comprehensive weight loss program, we have to offer all those surgeries, and we have to offer those surgeries for people who may have failed a procedure or just having an issue. You know, I don't think it's something we can offer and say, well, it's not our problem anymore. And even if they've had surgery elsewhere, we do our best to try to take those patients in because they need help.
Well, I'm going to brag on you a little bit if you wouldn't mind. You're not only just an incredible surgeon here in Kentucky, but you're also now a national teacher and educator. How did that all come about, and is it something you love doing?
Oh yeah, I love it. It keeps me busy outside of this, which I'm already busy with, but I enjoy it. I enjoy sharing with other people all over the country the things that have made a big difference in my patients with robotic surgery. And the past few months I've been in Houston and Chicago and Atlanta teaching of various places, and I just want them to be able to offer their patients what I've been doing for some time.
I think it's fantastic. Dr. Eric Smith, as always, great to speak to you.
Thanks.
If you want to find out more information, there it all is up on the screen, everyone. Georgetown Bariatrics and Advanced Surgical Surgeries. We'll be back after this short break.